that was pretty cool. So what I want to talk to you tonight about is what I think should be our hottest product heading into summertime. And so I'm going to challenge everybody to mark tonight down and start to focus on doing a certain number of the MNO Plus card programs every single month. Now, I know what a lot of you are thinking. It's like, well, you know, if I sell one, I only make $5 or $8.50. But tonight, what I'm going to show you is what happens if you dedicate yourself, get consistent, get persistent, and start to sell 10 of these a month, what it will look like for your income next year. If I was able to tell you tonight that we could add an additional $7,200 a year to $12,240 a year to your income, could I get your attention for 20 minutes to learn a little bit more about the MNO Plus card? The bottom line is, people that you know, people that are in your family, people that you go to church with, people that you work with are going to get on a telehealth program. The question is, are they going to get on it from you? Because it is the future of our healthcare. Tonight I did a little investigating out online. I like to research things. This was from a magazine called Think Progress. It says, we believe the future of healthcare is on your couch, not going to different clinics where people can get preventative medicine, when people can get preventative medicine right there on your smart TV. Now, man, if that's not a statement, if that's not saying that we're on the right track here. I mean, we take Omnibox and we know that, you know, people are buying smart TVs, but we have the ability to help a person actually create a smart television set. Those are two products that go hand in hand. I mean, this is the future of healthcare, where you're actually going to interact with your doctor sitting on your couch in front of your smart TV. This gentleman was Prendergast said of the app available on iPhone and Android devices, if my child is sick and it's 10:30 at night, it's so much easier to access my doctor while my child is resting. 89% of healthcare executives said they expect telemedicine to transform the U.S. healthcare system in the next decade. 89%. Now, what I'm encouraging you to do is, like any insurance agent that's out there, is to get you a residual income set in place. There has been talk that maybe once this gets so big, they're going to actually make people have a license to be able to sell this. I don't think that's really going to happen. There are a couple of states that have put that into effect, but I don't think that's going to be a big deal. Now, here's the unique thing. It says the global telemedicine market is expected to grow from $11.6 billion in 2011 to $27.3 billion this coming year in 2016. Now, that's a massive growth. Worldwide revenue for telehealth devices and service is expected to reach $4.5 billion in 2018, up from $440.6 million in 2013. What that's basically saying is that there's going to be applications that you can put on your smartphone, applications that can go on your smart TV set that will actually allow you to be able to send things like temperatures, heart rates, oxygen levels, heart rhythms, blood pressure via telemedicine. Now, when that goes into effect and those apps start to hit, would you not think it would be a good deal if you had hundreds, if not a few hundred of people that you've actually shared this with? I'm telling you, all that you have to do is to share it. The number of patients using telehealth services will grow to 7 million in 2008, up from 350,000 in 2013. That's massive growth, and you've got a product that you can do that with. Telemedicine could potentially deliver more than $6 billion a year in healthcare savings to U.S. companies. Read what's in that. We're talking about small business owners offering telehealth to their employees could save over $6 billion a year. And the percentage of healthcare employers offering telemedicine is expected to increase by 68% by next year. Now we're talking in the time frame that we're here right now. This is not a spread over X amount of years. We're talking about 68% of all small business owners are going to be offering telehealth to their employees. So I encourage you to get tuned into this tonight, take some notes, and let's kind of get started. The unique thing about what you have is you have two places that you can sell the product, okay, as long as they have your activation code. And we all know what your activation code, that's your specific URL that triggers all of these different sales to you. If you want to send them to MNO, MNOplus.com, you can do that, or they can literally come through your marketplace. So you have two places. Here's something that I'm going to tell you. We are going to get very aggressive on marketing telehealth through the marketplace here in the next 60 days. We are already working on scripts. We are talking to talent that can come in. We're trying to set up a few interviews with some doctors so that we can make a powerful video that will literally set in your marketplace to help you convert shoppers to a MNO Health Plus program. So my hope for you is that you get educated about this, and let's really work on it so that number one, My Network One can help you sell X amount of these telemedicine programs through your marketplace, and then you physically can go out and sell some of these yourself. The other thing that we will be doing is we will start to have a link on our MNO TV website channel, which we are in the process of creating, and we will have at least 1 or 2 events a month that will be strictly targeted to telehealth. Now, once we have the station on the Omnibox, we will have those shows. They will be on demand, so that once someone gets there, it's just like watching your favorite pilot or your favorite program on television. It's all on demand. Watch it when you want to. But I can tell you that the way the box is being sold now from the Omnibox, so you can buy the box for $149, that's going to be almost like buying an information center for you, the rep, for the agents, I'm saying. And what I'm saying by that is that you could have home parties, savings parties, you can have training events in your house, you can have business opportunity in your house, and you're just going to hook your Omnibox up, go to the My Network One channel, and we're going to be delivering right there in your living rooms. This is going to be great for you to go out and market to college students, teach them how to have dorm parties, because now you can get the box without having to buy the monthly programming, and that gives us the ability to be able to pipe information, shows, and events live into your box. And as if you hear Eric Warwick and you hear all of these major MLM people talking about that, if you bill to events, you're going to have a very successful business. Well, my question is, what would happen if we could have an event every week and pipe these shows and these informations directly into your living rooms, into parties that you're having? And I can tell you right now, we are making that commitment. And we're really, it's very exciting. So you can access the MNO Plus card from the marketplace, which we're going to get very involved with that, and you can send people directly to the MNOplus.com website. Make sure they've got your activation code. Now, there's 2 plans out here, and one of them is $15, and the other one is $25. And as you can see by the little checklist in the box, this differentiates itself between the two of them. Here's the unique thing. For a perfect example, we have a couple of young men that work in the studio now, and healthcare kind of came up in the conversations, and they were basically saying that you know, they just really couldn't afford insurance. We started talking to them about telemedicine, and it was just like a light bulb went on. Keep in mind, even at the MNO health program at $15, that can cover up to 5 people in your family, as long as they're living under your household. That's $3 a person. $3 a person. Now every month when and again, this is not insurance, but it's better than having nothing. And you know, my insurance, just insurance on me personally, is over $780 a month. So as these healthcare costs go up, we've got a solution here. We just have to get educated on it. We have to know how to talk to people about it. If you will understand this and you'll get good at it, what you'll find out is that most people don't even know that it exists. There will be people that will buy this that have health insurance. Why? Because you can get consultation fees, especially if you've got a lot of younger children, and you don't have to pay the copay. If you know your child's got a cold, or you know your child's got an earache, you can get prescriptions called in for it for going through telemedicine. And that's $15, and that's if you used it every day of the month or used it 5 times a day for the month. If you got 4 or 5 kids, how many copays are you paying every single time you go to the doctor's office when you already know what's wrong with your child? And it works the same thing for adults. So the MNO health program starts with, you know, the main stable thing, which is TeleDoc, and that's doctor by phone. And it's all about feeling better now. Having 24/7 access to a doctor is only a call or a click away, anytime, anywhere, again, with no consultant fee, no consult fee. There's a lot of telemedicine programs out there that charge $29 or $39 on top of the monthly fee if the doctor actually calls in a prescription. We do not do that. With TeleDoc, you can talk to a doctor by phone or online video consult to get a diagnosis, treatment options, and prescriptions if necessary. Now let's talk about a little bit more of that in detail. Besides the 24 access to a doctor online or by phone, it's all about fast treatment. TeleDoc responds within 16 minutes on an average. So within a 16-minute period of time, you're going to have talked to a nurse and have talked to a certified board doctor. Now, I've been talking to my doctors about this, both my cardiologist, my general doctor, and they're basically saying that their offices are already getting involved with this because it is the future. And it's kind of like them saying, look, we either get on board with this or we get ran over by it. But it's where the future is going. The other unique thing about that is your ability to be able to talk to a doctor from anywhere. So if you're at work and you get sick and you just can't get away to get to a doctor, you can call them from work. You can call them from home. If you're traveling on vacation, you constantly have access 24/7 with this program. The TeleDoc now has an app. It's available if you're on the program. You can get that app in the App Store or at the Google Play Store. Now, this is the way that TeleDoc is going to start to roll out these interactive applications where the doctors, if you're going to be able to be on your phone, truthfully, and be able to talk to your doctor almost like FaceTime, and he may say, hey, look, put your index finger on this particular app on the phone. I need to take a reading, and they're going to be able to do that. This is the future. And so it's all about helping families save money by avoiding expensive ER or urgent care visits. Again, TeleDoc consultation fees are free. Basically, when we talk about a consultation fee, if the doctor has to call in a prescription, there's no additional charge. I don't care how good your insurance is, even as much as I pay for my insurance. When I go to the doctor's office, if I go to my general doctor, it's like $20 a visit. If I go to a specialist like a cardiologist, it's $30 to $35 every time you walk in the door. Tedoc treats conditions like cold or flu, allergies, bronchitis, urinary tract infection, respiratory infections, poison ivy, sinus problems, pink eye. The Medical Association says that 75% of all conditions that are treated in the doctor's office, in an urgent care, or in an emergency room could have been treated via the phone or the internet through a web app or through a webcam. So we also have dental. So it's not just the Teledoc program. Everything that you're going to see in blue here is going to be in that $15 a month program. There's over 158,000 dental practices nationwide. You can save anywhere from 15 to 50%. Save on cleanings, x-rays, crowns, root canals, and fillings. I can add something to that. If you got, most of you knew because you've heard me talk about it. If you have surgery done, which I did, I had to have 3 teeth completely removed. And as you heard me say before, I'm a big baby about that, so they actually put me out and woke me up when it was over, which was great. And they took $511 off my bill when I gave them my MNO Plus card. $511. Now, I don't know about you, but you know that got me pretty excited because the card is only, if you take 15 times 12, the card's only costing me $180 a year. I just saved $511 like the first time that I used it. That's crazy. You can save on specialty dental care, orthodontist, or periodontist. I think that's how they pronounce that. It also is good for vision. There's over 20,000 vision providers nationwide. It also includes national chain and local retailers like Lens Crafters, Pearl Vision, VisionsWorks, JCPenney, Sears, Target, and there's a whole lot more of them that are out there. Save 10 to 60% on glasses, sunglasses, contacts, laser surgeries, exams, and the big one down here, which really surprised me, is 40 to 50% off LASIK surgery. Now, if you save 40 to 50% off LASIK surgery and you didn't have vision insurance, I could tell you that'll probably pay for your Plus card for about 5 or 6 years. So a lot more discounts. A lot of times when we think about you know, the MNO Plus card, we think just about Teledoc, just about that doctor, but there's a whole lot more. Prescriptions. You guys have heard Tony Willis get online and talk about how much money that he's saved, and in a lot of cases it's been better off to use his MNO Plus card than his normal insurance program. I hear all the time where pharmacists basically ask, well, where'd you get this card at? Because the savings are great. 10 to 80% off almost all medications, and there's over 60,000 participating pharmacies, including Walgreens, Walmart, Target, Rite Aid, and CVS. So from the prescription side of that, again, big savings. Diabetic Supplies. They've got a program that says save up to 60% off of diabetic monthly packages. I happen to be a diabetic also. I didn't really kind of understand that, if you want to be truthful about it. I'm going to try to call down tomorrow and get a better understanding of that. But if you are diabetic or know someone that's diabetic and you can save 15% off of individual testing supplies, let me tell you something, that's a big deal, because the expensive part of being a diabetic are those little test strips. And they get very, very expensive. I know I was talking to Kevin a couple of weeks ago, and his wife is diabetic now and having to use the strips, and it's crazy how expensive some of those strips can be. Hearing aids. There's multiple programs in here for hearing aids in our product. So one of them is called the Connect Hearing Centers, and that's 35% off hearing aids. They have over 300 locations. With them, you get a 2-year supply of batteries, unlimited follow-up visits. There's 15% off of Bell-Tone hearing aids. There's 40 to 60% off of online retail pricing over 100 different models of hearing aids. There's free hearing screenings in multiple locations all around the country, nationwide, and Bell Care and Lifetime Care programs. So there's a lot going on out there when we get to the point of hearing aids. And a lot of times we think about hearing aids, we think, okay, well, it's only for our grandparents or, you know, for ourselves if we've been up in age. But, you know, you'd be surprised how many younger kids today need the help of a hearing aid. So again, everything that you're seeing here, you're getting covered, everything, for up to 5 people in your family for $15. Labs, 10 to 80% off usual charges for blood tests and all other types of lab testing. Big discounts on CTs and MRI scans. I actually know somebody that needed an MRI. She did not have insurance. She actually got on the MNO Plus program and saved herself enough to pay for the card all year and more by getting a major discount on an MRI scan. So MRI, CT scans, and ultrasounds. So again, you know, the perfect scenario would be that none of us have to use any of this, but we know as we start to get older, that's probably not going to happen. Health Wealth Connection. It was very surprising to me how many people actually use this. And basically it's designed to help you with your personal finances by guiding through you particular types of debt consolidation. And I think what they're basically saying here is stress is a very vicious animal. And they've got a whole program, and as we know, a lot of people are stressed out because of their finances, tired of looking over their shoulder. So we know that a lot of people get involved with MLM, home-based business companies, to try to relieve some of that stress, to have some additional income coming in. This is just a program. It's included in here. It helps you kind of set goals, try to get control over your debt, and just a lot of good stuff in there. So like I said, it really surprised me how many people really get plugged into that. And then, of course, vitamins is one of the last things that's on the $15 program. We're in a little bit different situation here because we've got some great vitamin companies inside of our marketplace. So you got to kind of weigh the two out to see exactly which one would be better. But it does have a vitamin program. It's got some toll-free online shopping. I think there's over 400 brands and 12,000 different items and some of the top names in vitamin care. So you got 2 options there. Now, if you go to the $25, the MNO Health Plus, we add some additional things in there for that program. Now, the first one's going to pay you $5 commission every time you sell one of this one. This one's going to actually pay you $8.50 commissions. But alternative medicine, man, if I would have been setting this up personally, I probably would have never put that in there, and I would have made a huge mistake. It is a big service that people are really, really interested in. And I hear people talk about it all the time. So that's 10 to 30% off of treatments and services. There's over 40,000 practitioners nationwide available in this program. It includes acupuncture, nutrition, counseling, massage therapy. I didn't know it did that till tonight. I've not, you know, been in a position where I've gone out and got a lot of massages, but let me tell you what, man, for birthday presents and something, that's something that's always at the very top of my list. And now that I know I can get a discount on it, it really kind of makes me pay attention to it. Holistic medicine, and then exercise and movement specialists, like getting discounts on yoga classes, chai classes, or chi, however you pronounce that, Pilates, and a lot more. So again, all of these things are included in the MNO Health Plus program. You got everything that was in blue, plus all of these additional ones that we're covering that are in green. Nurse Line. You know, Nurse Line is something that, again, I'm getting more educated about it, but it's really good because a lot of times people just call the nurse line to ask questions. Maybe you're not sick. Maybe you've just been getting a little twinge here or been feeling a little bit funny. You don't really think it's something that you really need to get a doctor involved with. So you can call this nurse line and basically talk to them about anything. If you've got a medicine that you're on and you're really not sure why you're on that medicine or what it's supposed to be feeling like, or so they're available all the time, 24/7, 365. It's a very, very cool program. This one, I think, might be one of the very most important one, and it's called Medical Bill Saver or Medical Advocate. And what these people are doing is their job is to negotiate your medical bills for you. And it's amazing the stories that I have heard from this. A lot of you remember Brian Conley when Brian was with us, and I mean he just had some unbelievable stories of people that actually got saved almost from this, from bankruptcy, where they had these outlandish medical bills, and the doctors and they were constantly hounding them and ringing their phone off the hook, and they got the Medical Bill Saver program involved, and they got their medical bills in some case slashed 50 to 70%. And so I think that's a very cool thing. Again, it's just another added bonus in there, and they actually represent you in those negotiating those bills down. It's kind of funny because a lot of times, we hear what they want to charge us as an individual, and then we hear this other price that they say, oh, well, if you were on insurance, we would only bill the insurance company for X amount of dollars. So if you're going to pay it personally, it's $20,000. If the insurance company is going to pay it, the bill's only 10 grand. So that will tell you right off the bat that there's this massive negotiating power out there, and that Medical Bill Saver can really help you with that. This next one here is the Medical Health Advisor. Now again, this has some of the same things that you're seeing in the TeleDoc, that you're seeing in the nurse line. It's all about saving time and money. I mean, that I didn't make that one up. That was their first thing listed in their highlights. It's healthcare and insurance guidance. Basically what this is in some cases is this is where they're really trying to help you make sure that you're on the right programs, that you're seeing the correct doctors, you're not spending a lot of money someplace where you don't need to. Assistance in finding doctors or hospitals and other providers that can help you with whatever ails you. They do appointment assistance for you. It's a very good place to come and get a very unbiased opinion on what you're going through. And they also have what they call a Use Health Care Cost Estimator. So they can basically tell you that, hey, I'm getting ready to go in, and maybe it's having a knee replaced or a shoulder replaced or whatever that might be, and they're going to basically tell you that this is kind of what you can expect that cost to be, because you have to go through some rehabilitation and some particular medicines here and there, and so it gives you kind of a map to follow through. They also help you resolve insurance claim and billing issues. So again, you've got a professional on your side. And I can tell you, anytime that you've got a professional on your side representing you, you're going to come out ahead. They also explain tests, why maybe a doctor would be asking you to do a particular test or a particular treatment or a particular medication. And then they also help people that are on Medicare and other government insurance program assistance, because there is so much stuff that's out there. There's a lot of stuff out there that I'm telling you, just us as normal consumers, we don't know is even available to us. So this is a great place to be able to go there. I mean, this is what these people do for a living, and they may be able to come in and say, wow, did you know that you qualify for this program? And maybe just wipe out some medical expenses for you all the way around. So this is a great program to get plugged into. And then, of course, we have identity theft protection, which is basically helping you protect your identity. We also have a Legal Care Direct. And again, this is just legal advice. It's not like you got an attorney on retainer for you, but a lot of times, you're just really not sure what you should do. So you could talk to them about, should I go see a local attorney? Hey, I've got this letter that someone sent me. Can you review it for me? I need you to review the response letter that I'm sending back to them. Assistance with some different governmental programs that are out there. You get a free simple will by being a part of this. There's just a lot of information out there, and then it also gives a 10% discount on any contingency-based cases. Well, we all know how fast attorney bills can add up. So again, 10% of that. Again, you're looking at a cost of this MNO Plus program for the whole year it's $300 for 5 people in your family for $300. So it's a great program. And then we have Roadside Assistance. It's actually added to this one, and it's a very decent roadside assistance program. I know a lot of the new cars come with that, but in case you don't have it, it is available, and it's kind of cool because it can be used by any member of your house, the spouse, the children, or dependents up to the ages of 21. And so it covers the cars that are associated with that particular house, and I think that's pretty cool. Again, it's multiple coverage. So it does things like towing assistance, flat tire assistance, fuel, oil, fluid, and water delivery. So you get outside, you run out of gas, you lock your car, you lock yourself out of your car, your battery goes dead, you need a jump start. So all of those things are covered under this particular program. Now let's just talk, before we wrap up for tonight, let's just talk about the income opportunity. I think a lot of times we look at this and say, wow, you know, I'm only making $5 or I'm only making $8.50. So let's take a look at that says, okay, starting in June, I'm going to make a commitment to sell 10 of these every single month. 10. Now, here's the good thing about that. You could possibly walk into one business owner that you know, they may have 10 employees, and they said, well, I've heard about telemedicine, but I didn't really know where to go get it at. And you walk into an employer that has 10 employees, and they can put all 10 of their people on this program for $150 a month. Think about that. There's your 10 right there. That's $150. Man, employers don't even know that that exists. So if you did 10, eventually by the end of the year, you're going to have $600 a month residual coming in just off the telemedicine program. That's $7,200 a year in residual money coming in if you would just get focused this month on trying to sell 10 of these a month. And I'm telling you, you gotta really get your arms around this thing. You don't have to be a salesperson to do this. All you got to do with this is share it. If you take them to the website, you know, it explains every single one of these benefits in that package page. I'm going to go back and show you that right at the end of it. But if you went out and sold 10 of the MNO Plus cards every single month, at the end of the year, you'd be at $1,020 monthly residual. Well, that's $12,240 a year. And I don't know about you, but that's kind of worth going after, and just thinking that, well, gosh, if I did it the first year and then I did it again the second year, if I repeated that, I'm going to be making somewhere between $14,000 and $25,000 a year just off of telemedicine in a 2-year period of time. Now, I know 2 years sounds like a lot, but you know what I always tell people with this, it all starts with one sale, and that one sale needs to be yours. You need to be able to pull that card out of your pocket, pull that booklet out of your purse or out of your briefcase, or you know, carrying it with you in your in anything that you're carrying information with out there, and show people, say, hey, I'm on it. You don't think it's going to be easy for me, easy for me to share these with people right now, having saved $511 and almost forgot that I had the card on me. Shame on Rod. $511. So the one thing that I want you to know is that you go to your site, and the PlusCare benefits, if you'll click on that, and I'm sure that most of you know this, but here on this page, that little green arrow will open up an iframe window for you, and everything that we just covered is in here. You can get highlights, you can see a video about that particular product. Some of them, like prescription plans, they get into sample savings, FAQs. Everything that you need to go out and make a presentation to someone is right here. So I encourage you that if you'll go out there, and your goal every month is to say, look, I'm just going to do this. I'm going to go out and I'm going to sell 10 of these a month, and I'm going to do this for the next 12 months in a row. And then in a couple of months, we're going to start getting you some sales just directly from your marketplace. People that are just visiting there and shopping for everyday items all of a sudden gets exposed about telemedicine. The great thing about telemedicine, if they walk into a Walgreens, they see a United Healthcare, they're starting to hear about it. You guys have got the best price on it, so I really encourage you to get out and share this, because I believe that's all you got to do. I do not believe that you have to sell it. I believe that you just have to share about this, and we'll start having more of these training things. So Kevin, that's what I've got tonight. Everybody, don't forget about the special Fast Start program we've got going on right now. If you bring somebody into the business, you're going to get a $100 Fast Start bonus instead of $80, and you're going to have that paid to you within 24 hours if you have a My Network One pay card. So Kevin, with that, I'm going to open it up. If you want to wrap us up, or if there's anybody out there that's got any questions, I didn't get a chance to look at the question pane to see